Good evening, doctors. Welcome again. Today we are going to discuss about spinal muscular atrophy. This is a genetic disorder when a spinal cord gives nerve sensation to the muscle. When nerve dies prematurely and muscle atrophies occur. This is known as spinal muscle atrophy. Let's discuss in detail. When brain gives signal to upper motor neuron, these upper motor neuron act on a spinal cord anterior horn and which transmits information by lower motor neuron, and these nerves are dyads which acts on muscle at neuromuscular junction, so it produces atrophy. Okay, when lower motor neuron dies, stops working, muscle weakness and flaccid or lower tone paralysis, deep tendon reflexes absent when we check by hammer. Okay, this is spinal muscle atrophy type 1A. This is congenital spinal muscle atrophy. Most severe, starts before birth, decreased fetal movements. Type 1B is infantile spinal muscular atrophy, also known as Werding-Hoffmann disease. Normal at birth child, but first few weeks hypotonia occurs, progressive weakness. Here the muscle weakness proximal then distal in legs. Okay, weakness in suckling, chewing, swallowing muscles and aspiration and shortness of breath we can see. Few years survival. Type 2, 3 and 4 is mild. Fourth is mild, third is little, second and first is worse. Chronic symptoms include scoliosis, extremities, thin limbs, homozygous deletion of SMN1 gene, survival motor neuron 1. It acts on chromosome 5. This is autosomal recessive. Supportive treatment and nutrition is needed for this disease. So guys, I hope till here it's very much clear for you. If you're new on my channel, please subscribe it, and if you like this video, put like on it. Thank you. Good day. Goodbye. That's all.